So your blood pressure is reading high? Do not worry. Most adults will get high blood pressure at some point. Most don't know they have it. And the not knowing is the dangerous part. The good news for you, you now know, and blood pressure is one of the most fixable issues in medicine. And the steps you take will significantly reduce your risk of heart attack, stroke, dementia, and early death. I'm Dr. Owen Colgan, I'm an ER doctor, and I deal with blood pressure problems every shift. In this video, I'll show you what your blood pressure reading means, why it matters, and what to do about it, including a simple routine you can do while watching TV that will lower your blood pressure more than aerobic exercise. Let's get into it. But first, what is blood pressure? Well, your heart is a pump, your arteries are the pipes. Every time your heart beats, it squeezes blood through those pipes to reach every part of your body. Blood pressure is simply a measure of the force needed to push that blood through. If your pipes are wide, flexible and clear, blood flows through easily and not much force is needed, and your blood pressure is lower. But if your pipes are narrow, stiff or clogged, the heart has to squeeze harder to push the same amount of blood through, more force, higher pressure. You get two numbers. The top number, systolic, is the pressure in the arteries when the heart squeezes, the peak force. The bottom number, diastolic, is the pressure when the heart is resting between beats, the baseline pressure in the pipes. 120/80 is considered normal, above 130/80 is elevated, above 140/90 is stage 2 hypertension. Now, this is important. Your blood pressure is not a static number. It changes literally from second to second. It's one of the most dynamic measurements in your body. And all sorts of everyday things push it up. When you exercise, your systolic pressure can jump by 40 to 70 points, and that's your body doing exactly what it should. Anxiety adds 10 to 15, a full bladder 10 to 33. Just talking during the measurement 10 to 19, crossing your legs 8 to 15. And if you put the cuff on over your clothing instead of bare skin, it can read up to 50 points higher. That's enough to turn a normal reading into what looks like a crisis. This is why a single reading is useful but not conclusive, why how you measure it matters, and it's why the doctor's office is actually one of the least reliable places to check your blood pressure. You're often a little anxious, the measurement can be rushed. That's why 15 to 30% of people with high readings at the doctor have perfectly normal blood pressure at home. That's called white coat syndrome. Hypertension is when your readings are consistently high over repeated readings at rest when you measure it correctly. And I'll show you how to do that shortly. But first, why it matters. Having untreated high blood pressure for a long period of time is one of the most damaging conditions we know of. Think of your blood like a river. A gentle river flows without causing much damage, but increase the force of that water year after year and it starts eroding the banks. That's what sustained high blood pressure does to your arteries. It damages the artery walls, it accelerates plaque buildup, it forces your heart to work harder with every beat until the muscle thickens and stiffens, it damages the tiny vessels in your kidneys and your brain, which is why high blood pressure is the single biggest modifiable risk factor for heart attack, stroke, kidney disease, and dementia. And here's what makes it so dangerous. You can't feel it. You can walk around for years, decades even, with blood pressure that's slowly damaging your body, yet feel completely fine. No symptoms, no warning until something breaks. It is a silent killer. In the ER, I sadly see this too often, the stroke in someone who felt perfectly healthy, the heart failure in someone who had no idea their blood pressure had been high for 15 years. And I'll be honest with you, until recently I had never checked my own blood pressure. There's a comfort in not knowing. If you don't know, then you don't have a problem, right? And doctors are guilty of this too. But hypertension has doubled globally in the past 30 years. Nearly a quarter of adults under 40 now have it. And most of them don't know. And going unnoticed for years is incredibly damaging to the body. So it is definitely better to know and to do something about it. Every 10-point reduction in systolic blood pressure cuts stroke risk by 27%, heart failure by 28%, and overall mortality by 13%. And the earlier you know, the more damage you can prevent. So if you've just seen a high reading, here's what you should do. High blood pressure with symptoms is a medical emergency. If you have a high reading and a severe headache, chest pain, changes in vision, sudden confusion, or difficulty speaking or moving, phone the emergency services. But in most cases, a high reading is flagged and you feel perfectly well. This is not an emergency, and there is usually time to properly diagnose it, then bring it down gradually over the coming weeks. So your first job is to figure out whether this is a one-off reading or a pattern. Here's what to do. First, buy an upper arm blood pressure cuff and make sure it's clinically validated. I've put a link in the description to some resources where you can check that. You don't need to spend much. A good validated monitor costs around £20 to £40 or $30 to $50. Then, here's a quick checklist before you begin. Empty your bladder. Don't have any caffeine or cigarettes before you take the measurement. No exercise for 30 minutes before. And the first time you measure at home, check both arms. If there's a consistent difference of more than 10 to 15 points, use the higher reading arm going forward. Now for the measurement itself, sit in a chair with your back supported, feet flat on the floor, legs uncrossed, arm relaxed on a table in front of you at heart level, not hanging by your side. Ensure you are using the correct cuff size and placement, follow the instructions that come with the monitor, and apply on bare skin, not over clothing. Rest for 5 minutes before taking the first reading, and don't talk during it. Take 3 readings a minute apart, discard the first, your body hasn't fully settled, average the next 2, that's your number. And do this morning and evening, ideally at the same time each day, keeping a diary of those readings for a week. Then bring that to your doctor. That's far more useful than a single reading in the surgery, and it's far more accurate at diagnosing hypertension. One last thing, if your home readings are consistently very high, say repeatedly above 180 over 110, then make an appointment to see your doctor in the next few days. So if your readings do turn out to be consistently high at rest, how do you treat it? Well, broadly speaking, there are 2 approaches, lifestyle and medications, or ideally, a combination of the 2. But let's address them each separately, starting with lifestyle and the most surprising finding of this whole video. Exercise is a well-established way to lower blood pressure, but which type is best? It isn't running, it isn't cycling, it isn't weights. It's something you can do while watching TV, and not enough people know about it. A major analysis in the British Journal of Sports Medicine compared every major type of exercise for lowering blood pressure, and here's what they found. Aerobic exercise, walking, cycling, running around 4 to 5 points, resistance training similar, high intensity interval training around 4, combining aerobic and resistance around 6, all genuinely effective, all recommended. But the runaway winner was isometric exercise, around 8 points, roughly twice as effective as any other exercise type. Now, isometric exercise is where you hold a position under tension without moving, no reps, no running, just holding. And the 2 that have been most tested are wall sits and a hand grip protocol. For wall sits, you lean your back against a wall and lower yourself until your thighs are roughly parallel to the floor, and you hold. For the hand grip, you squeeze a hand grip strengthener at moderate effort, around 30% of your maximum. They each use the same protocol, 2 minutes on, rest for a couple of minutes, repeat 4 times, that's about 12 minutes in total. Do that 3 times a week. Now, one thing to keep in mind, the isometric finding is newer and the trials are smaller than the aerobic evidence base, so treat it as a powerful addition, not a replacement. Other lifestyle actions that make a big difference, the DASH diet with sodium reduction, 7 to 14 points. I've put a link in the description to more information on that. Weight loss, roughly a point per kilogram. Reducing alcohol, 3 to 6 points. Better sleep and stress management, 3 to 5 points each. And the great news, you can combine these lifestyle changes, the benefits stack on top of each other, so you can achieve 10 to 20 points of systolic reduction. That's comparable to blood pressure medication. And the improvements start happening within weeks, and it's worth emphasizing lifestyle changes don't just lower your blood pressure, they improve your entire health. That's why they matter even if you're taking medication. Speaking of which, there's a narrative in parts of the wellness space that needing blood pressure medication means you've somehow failed. You just didn't make enough effort with lifestyle changes. Now, that narrative is harmful. There are three important things to say. First, some people exercise, eat well, sleep well, maintain a healthy weight, and still have high blood pressure. Genetics, kidney function, arteries stiffening with age. Some people have issues that no amount of lifestyle change can overcome, though it will still help. That's biology, not failure. Second, medications are highly effective. The evidence that blood pressure medication saves lives is amongst the strongest in all of medicine. And third, for most people, the best answer is both working together. Medication brings the pressure down. Lifestyle changes additionally improve the underlying health of your heart and arteries. Each makes the other more effective. So what does this mean in practice? If your readings are only a little high, you could start with lifestyle alone and see if that's enough over a month or two. But if they're significantly high, say above 160 over 100, it's recommended you start medication alongside the lifestyle changes. Then over time, with your doctor's guidance, you may be able to reduce the dose or come off medication entirely. But if you need to stay on it for life, do not worry, it is worth it. So here's my verdict. If your blood pressure has been flagged as high, take it seriously, but take it calmly. Get a validated home cuff, measure it over a week, take the log to your doctor. That gives you a real answer. And if it does turn out to be high, lifestyle changes make a significant difference. Walking, better diet, more sleep, less alcohol, and build in wall sits or a hand grip strengthener a few times a week. They compound. And if you also need medication, take it without guilt. It's one of the most effective treatments we have, and it works even better alongside lifestyle changes. And every point you bring that number down is real protection against some of life's biggest killers. In the ER, I see two kinds of people: those who panicked over a single high reading and spent hours in a waiting room they didn't need to be in, and those who ignored their blood pressure for years and arrived by ambulance when it was too late to undo the damage. The right place is in between, aware but not anxious, informed but not obsessed. Check your number, understand your trend, take action if you need to, and then get on with your life and be grateful that you found out and are taking action. You're ahead of most people. If you'd like a complete framework for building sustainable health habits, I've put together a free guide, link in the pinned comment and description below. And if you found this video useful, subscribe for more. I cut through the noise and figure out what actually matters for your health. Thank you so much for watching. Until next time, take care.